Welcome, everyone. It's 9 o'clock, so we're going to go ahead and get started. I wanted to let everyone know that this is being recorded today. And everyone, I'd like to ask everyone to stay on mute until you have possibly a question at the end. The overview for today is going to be me. My name is Nicole Murad. I'm the current chapter chair for the Colorado chapter of the American Immigration Lawyers Association. I'm going to give a brief introduction of our concerns and asks today. Then I'm going to pass it over to our two immigration law experts and then our physician that we have ready to speak about the current situation at the Aurora Civil Detention Center. So with that, I'd like to go ahead and get started. I'd like to thank everyone for attending our virtual conference today. We asked you all here today because there is an uncontrolled transmission of COVID-19 at the Aurora Contract Detention Facility, a civil detention facility. This outbreak is both in the detainee population and in the staff working there, which poses a severe threat to the safety and welfare of our communities. This affects every single person in Colorado on the Front Range and beyond, because as these people get sick, they will be going to our hospitals, which will be overwhelming to our local health institutions. Reports in Colorado already show that at the current transmission rates, ICUs in Denver could be full by December. That does not even include the numbers at the Aurora Contract Detention Facility. Additionally, with staff coming in and out of the facility and detainees being transferred in and out, there's constantly new kindling to put into this COVID-19 fire at the detention center. A surge in preventable cases is going to further strain our hospitals and healthcare resources, and this is unfair to each and every one of us. Credible sources have indicated to us that the infection rates at the Civil Detention Center could be as high as 25 to 30% of the population based on the massive spike in the last few weeks. Making matters worse, ICE's public information is confusing at best. For example, last week, the Colorado Department of Public Health and Environment reported on its website that there were 91 COVID positive cases currently active at the Civil Detention Center with 13 staff. That same day, ICE's report to Colorado Congressman Jason Crow's office showed 34 detainees and 2 staff currently infected. So these numbers, again, are confusing at best, and we're asking for more transparency and accountability. And in an effort to promote this, AILA Colorado has reached out to ICE in an attempt to address the discrepancies directly and address detainee care. ICE has declined to respond to us and further used a pending litigation, which we're going to talk about further, as a reason not to provide information. Yet this is the same lawsuit they appear to be openly disregarding. All of this lack of transparency harms our community. So in terms of this lawsuit, which we're going to go over further soon, ICE is refusing to meaningfully comply with court orders. There have been 2 federal court orders known as the Fryhot orders, ordering ICE to do a meaningful review and release of detainees for anyone who is considered high risk, and also to provide further standards of care for detainees. The federal judge ordered ICE to do this first on April 20th of this year, and again just recently on October 7th. The judge concluded on October 7th that ICE had failed to identify, track, and meaningfully review for release all detainees with the additional risk factors. So that's why we're here today. And as I mentioned earlier, we have immigration law and medical experts ready to brief you on these latest updates and the effects on the community at large. This conference today is being sponsored by the Colorado chapter of the American Immigration Lawyers Association, AILA. AILA is a national association of more than 15,000 immigration lawyers and law professors who practice immigration law. We are a nonpartisan, not-for-profit organization. Our speakers today include Elizabeth Jordan, Laura Lunn, and Dr. Carlos Franco Paredes. Elizabeth Jordan is the Director of the Immigration Detention and Accountability Project at the Civil Rights Education and Enforcement Center. And she is one of the main litigators in this Fry-Hot suit. So she will be discussing the order itself and ICE's, what ICE is doing to respond. Laura Lunn is the managing attorney for the detention program at the Rocky Mountain Immigrant Advocacy Network. And she will be relaying detainee accounts from inside the Civil Detention Center, as well as discussing the breakdown in due process associated with mass quarantining and incarceration. Dr. Franco Paredes is an associate professor of medicine at the University of Colorado in the Department of Medicine, Division of Infectious Diseases. He is currently the Infectious Disease Fellowship Program Director, supervising the training of medical students, internal medicine residents, and infectious disease fellows at the University of Colorado. During the pandemic, he has witnessed firsthand the impact of COVID-19, and he has also conducted many inspections of correctional facilities during the pandemic. So he will discuss the current situation at the Civil Detention Center in Aurora, as well as the public health risks associated with continued detention. Full biographies are available in the press packet that we have provided. And with that, I'd like to pass it over to Elizabeth Jordan.
Thanks, Nicole, and good morning, everyone. As Nicole mentioned, just to reiterate, I work at the Civil Rights Education and Enforcement Center. I'm an attorney there. We focus on the medical care, mental health care, and disability needs of people in ICE custody. And we are counsel on Fry-Hot versus ICE. And I'm just going to give you a little bit of information on that lawsuit. It's a systemic challenge to ICE's poor medical care practices. We filed the case long before COVID was present in our communities, but ICE's failures to respond adequately to all different kinds of medical needs of the people in their custody, I think really colors the way that they've handled and failed to handle the COVID-19 outbreak. So there's that context. I will also mention that this case challenges the entire detention system. So it's applicable to what's happening at Aurora, but what's happening at Aurora is unfortunately not unique. And the ICE detention system as a whole is putting people's lives at risk. So in our case, which is docketed in the Central District of California before Judge Jesus Bernal, we challenged back in March what we thought was going to be signs were already pointing to ICE being inadequately prepared to handle the COVID-19 outbreak. Detention centers like ICE facilities, like jails and prisons, are considered congregate settings, and they are inherently dangerous for the spread of disease. And we know this in part because ICE has had a history of other kinds of infectious disease outbreaks in their facilities, things that are under control in our communities. And much of what we're talking about today, in our opinion, was preventable if ICE had taken steps earlier. So in our case, our public health experts, including Dr. Franco Paredes and others, made very clear that the safest thing to do for people in ICE custody was to let them go home. ICE custody is civil detention, as Nicole mentioned. Nobody is here as punishment, although nobody in this country has been sentenced to death by COVID. I want to make that clear as well. And so ICE was ordered in April to consider everyone in their custody who is at risk of serious complication or death to be reviewed for release so that they can go home and shelter in place with their families. In October, our judge noted that ICE had failed to meaningfully do that and clarified his earlier April order, making clear that they were required to. He noted that many people in ICE custody are not under mandatory detention. In other words, their presence at the facility is entirely at the discretion of ICE, and that those people should largely be released. He also ordered that people who are in mandatory detention are entitled to an individualized review, weighing their risk factor for COVID against the risk they might pose to the community. And if the risk factor outweighs the other factors, then they should also get to go home. Our judge also was very clear-eyed about the fact that ICE is not letting everybody out, and he ordered them to increase the standards of care for people who are at risk of COVID-19 infection who remain detained. So in October, ICE was ordered to end the use of solitary confinement as a method of quarantine, which is very dangerous for people's mental well-being. He ordered an increase in testing and tracking, which is, I think, a big part of what we're talking about today. And he also ordered increased standards of care for medical surveillance of everybody at risk and protocols for their care and, if needed, hospitalization. Bearing in mind what Nicole mentioned, that hospitals are already very stressed and that many of these detention centers are located in places where community resources are strapped. He also, again, ordered that people be considered for release. This order came down more than 3 weeks ago. And we've had reports as recently as last week that people are still in extended lockdown. I think Nicole's comments made clear that the testing regime is not clear and not being implemented. And so we are concerned that despite 2 clear orders from a federal judge to which ICE's compliance is not optional, they are still not taking the steps that are needed to keep people safe. Thank you.
Thank you, Elizabeth. Laura?
Thank you so much, Nicole. Thank you everyone for listening. We're really grateful that we have your attention on this issue. So again, I'm Laura Lunn. I'm the managing attorney of the detention program at the Rocky Mountain Immigrant Advocacy Network, otherwise known as REMAIN. REMAIN is a nonprofit organization founded in 2000 that serves low-income adults and children in immigration matters. REMAIN educates non-citizens about their legal rights, provides zealous representation to uphold due process, advocates to improve detention conditions, and promotes an immigration system where detention is no longer a reality, employing more humane and cost-effective alternatives. First, I want to talk about what the system is, and then I want to provide some highlights about who it affects. So as we all know, since March, due to a global pandemic, the way that our society functions changed drastically. People tucked away in their homes for safety, but behind closed doors, people are sandwiched together in the custody of the federal government, awaiting their hearings before the immigration court. They are stripped of their personal agency and have no way to practice social distancing. No meaningful changes have been made to modify the way immigration detention is being operated in this country. To be clear, this type of detention is not meant to be punitive. In fact, that's illegal. Our clients are not awaiting a criminal hearing and they are not serving a sentence for a conviction. The sole reason Immigration and Customs Enforcement, or ICE, is authorized to detain people is to ensure that they appear for court. Why is the ability to attend your court hearing so important when you're held in ICE custody? Well, it's the primary mechanism that allows people to leave detention. Some people ask for orders of removal so they can be deported to their home countries. Others seek release on bond before the court. Finally, many people win their immigration cases and are awarded lawful status that allows them to live in the United States for the rest of their lives. However, when there are high rates of infection within a detention facility, quarantines commence. They serve to halt the movement of people within ICE custody, including their ability to attend court. This creates significant delays which impact the due process rights of people in detention. Thus, the purported purpose of detaining people to ensure that they appear for court is thwarted, and the fact of detention itself is the underlying reason why people are unable to access justice and an ultimate outcome in matters. So we know that detainee isolation is bad for emotional well-being. So people in detention are mothers, sons, daughters, brothers, and sisters. We're talking about breadwinners, business owners, people with dreams of a brighter future and a place that allows who they are without fear of reprisal. Although our clients are not in a place of comfort, I think it's really important to highlight that the conversations are striking we have with our clients when they tell us about taking care of one another and creating a really strong community within the detention center, because that is the best way for them to feel safer. And I think it's really important for us to give them an opportunity to speak for themselves and explain their experiences. I'm going to share snippets of recent conversations I had with two of the people we serve who wanted to share with you all their perspectives of what it is like to be living with COVID-19 while incarcerated in ICE custody. Here's the first. I've been here over a year. We wouldn't have caught the virus if they hadn't kept bringing people in. The day I was told I tested positive, there were 12 to 14 people who tested positive. Nothing that is happening here is our fault, yet we are the ones paying the price. And another client recounted, I don't want to think about these people anymore, referring to his custodians. I look forward to the day God makes me free. With my attorney and social worker by my side, they aren't going to keep me here forever. One day the door is going to open for me. Until then, I have to keep positive and be patient and wait for that day. I think that these two quotes really highlight the fact that people lack control over their lives when they're detained. They have no control over who is coming and who is going and when they will get to be released. And again, just reiterating, they don't have a sentence, so nobody in ICE custody actually knows when they're going to get out. Our clients have a constitutional right to safety, but more than that, as people living through a global pandemic, they should have the opportunity for the comfort found by being with loved ones, and they shouldn't be forced to choose between pursuing their right to immigration relief and life-saving freedom. Thank you so much.
Thank you, Laura. Dr. Franco Paredes.
Yeah, thank you, Nicole. Thank you, Liz, and thank you, Laura. As Nicole mentioned, my name is Carlos Franco. I'm a physician at the University of Colorado, and I would like to use this next 5 minutes to, I would say, in a brief message, the public health implications of what is happening at the Aurora detention facility. And I take this responsibility with the, I would say, with the utmost responsibility, and it's an honor to be here today. And in many ways, is representing the voices of some of the clients, patients that I've spoken to or evaluated that I know they're in detention at the Aurora facility. I collaborate closely with Laura's group in doing some of these second medical opinion evaluations. And I know the first thing I would like to talk about is that I'm aware of many of the detainees currently at the Aurora facility are people who, based on CDC criteria, based on our own experience at the hospital, and based on whatever scientific publication available, are at the highest risk of medical complications if becoming infected with COVID-19. Some of them, I'm aware of at least one that that has these risk factors, that has become infected, and it's hard to know, as Nicole pointed out, the what is happening with these patients, what is happening with these number of cases. So the first point I would like to leave very clear is the fact that we do know that there are many of the client patients inside the detention facility are at high risk of developing complications and potentially dying from COVID-19. Secondly, regardless of whatever the different accounts reported in the ICE detention site, in the CDPHE, the Colorado Department of Public Health and Environment, or the TRICARE evaluations or reporting system, it's clear that there's an outbreak. And this outbreak, looking at the ICE detention centers throughout the country, is at this point is the second largest outbreak, followed by one in Los Angeles. So this number of cases currently reported as 45 positive cases. It's hard to know if that's exactly the number or if the number is higher. However, regardless, as I mentioned, this number indicates the tip of an iceberg of a ongoing transmission or clusters of transmission within this facility. And our concern is that we know that this infection is not, or this viral infection, respiratory with respiratory or droplet transmission. It's many people do become infected, many people do recover, but there's some of them that recover very slowly. They may have some long-term sequela. And most importantly, when these clusters of I would say, there's no interruption of transmission of these clusters in an effective and rapid manner, reaches these vulnerable populations or these vulnerable patients, that's when we see deaths. And that's why it's important to note that if you look at the what the ICE reporting site, the 8 deaths that they currently have reported throughout the country, these individuals had significant risk factors. Many of them were actually in very prolonged detention. Some of them waiting deportation for months, which is hard to understand. Not being an attorney and not knowing all the procedures, how they keep people for such a long time without either a due process or so on, as Laura mentioned. So those are some of the important things. So number one, again, that we know many people do have significant risk factors, discussed in the Freiheit lawsuit by Liz. We have heard Laura's accounts by individual clients. But again, what I would like to be like a voice for many people that I know inside as a physician, is that these detention poses, in addition to these morbidities, that could be diabetes, heart failure, you name it, all of them, people living with HIV, for example, that detention adds this significant stress. And simply, I understand that, the first thing that we request and what is the right thing to do from a public health perspective is to isolate those with confirmed cases, as well as quarantine those exposed. However, this is not, what I come to learn by doing these many inspections of facilities with COVID-19 outbreaks throughout the US and jails and prisons particularly, is that just putting people in isolation, as Liz pointed out, it's an important issue, but it's also a catch-22 where you do cause a lot of distress by isolating individuals to sometimes a degree of what we can definitely say is solitary confinement that exacerbate their mental disorders or trigger these mental disorders to a degree that it also affects the functioning of their system and puts them at risk of potentially dying from COVID-19 by impairing their immune system. So there's too many things to talk about, but those are the 2 key messages. And the third one, I believe strongly, and I'm not, I think we're a group of many physicians, public health practitioners, that we believe as medical experts that the right thing to do is to release individuals that pose no threat, to any public safety or there's no reason to keep people in there at the risk of, in a way, having them in a COVID-19 epidemiologic death row, just waiting for them to become infected. And I would like to quote one person that said to me in one of these inspections, because one of his cellmates died from COVID-19, he asked me if, detention or incarceration or dying from COVID-19 is part of the punishment of being detained or being incarcerated. And that takes me to, Albert Camus, the French writer, wrote in 1947, The Plague, the book, which I think is relevant to point here because he talks about this town in Algeria in the Mediterranean coast with an outbreak of the plague. And there's this character there, the main physician, who talks about decency. Decency and he describes decency as doing the right thing. And I feel that, you know, I'm not comparing myself to that character, but it really, when I read this book some years ago, it really struck my, you know, I would say my soul in many ways, to realize that we physicians, we can do more. And I think, you know, if you talk about social justice out there in the community and in these detention centers and correctional facilities, these are extensions of our own communities, and these individuals need to be protected, you know, as Laura pointed out, by a constitutional mandate and also by a moral societal responsibility to care for them, to reduce these injustices. And in this discussion, I mean, there's no question that health equity, you know, protecting them is part of this health equity central to social justice. So I do believe very strongly that, you know, again, that many people are at risk during this outbreak at the Aurora detention facility. Number two, that there is an ongoing outbreak. We would like to know more details, public details, more transparency. We'd like to know how are they treating these cases, because we know at least one patient was transferred to our hospital recently, ended up in ICU care. And his account, by reading specifically and discussing this with my colleagues, is that he was kept in the facility for 2 weeks with symptoms, and he arrived here on 7 liters of oxygen. So if you, instead of treating them early with the right treatments that we have now available, you're waiting for them to become complicated. I do have a concern as a physician, and would like to know more clarity, more transparency about what is happening, how are they treating these cases. And most importantly too, or equally important, is to know, you know, making sure that they're protected, but they're also not in the solitary confinement where no one talks to them. Nobody may check on them for some time, sometimes days in some of these experiences that we have. And some of the accounts of other detainees is that, you know, they moved from one section to another of the facility. They don't receive an explanation of why this happens. And
thank you, Carlos.
Of people not receiving testing. And this is the end. Thank you so much.
Thank you, Dr. Franco Paredes. I appreciate those comments. Can you talk briefly about what your estimates of the what your estimates of the infected population are at the detention center?
Well, so, you know, I would say I would just go by what is reported because we don't know in more detail, but at least we know that there's 45 confirmed cases, Nicole, by the ICE reporting system. And by looking at the CDPHE website, the Colorado Department of Public Health and Environment, you know, it's a little unclear because I think the total number of cases that they report include cases that were, you know, reported throughout the pandemic. So from March till recently. And, you know, I think what we can say from these numbers is, as you mentioned clearly, is that there's been a clear peak on the number of cases, particularly by the end of September, but we don't, you know, it's very, we don't know the exact number. We know that there's an outbreak. We know it's a significant outbreak, but we don't have it's difficult to make, you know, final estimate or a precise number based on these. And that's the reason, as you pointed out clearly, that we need, you know, better information to be able to understand the outbreak. Okay.
Thank you. Thank you very much. I want to leave time for questions. So I'm going to just provide a brief closing. As you can conclude on your own, we have in our community a potentially severe COVID-19 outbreak at the Civil Detention Center, combined with ICE's lack of transparency and accountability. This is the reason that we called the conference today. Our goal is to work with ICE to facilitate compliance, meaningful compliance with the Freiheit Order, improve detainee care in the pandemic, as well as increase transparency. We shouldn't need a judge's order to get a response. This is just common sense. there's no public interest served in exposing those in our community or a vulnerable detained population to increased risk of severe illness and death. So while our goal today is to shine a light on this rapidly growing issue, we have four items that we would like to ask ICE to comply with. The four items. The first is meaningful compliance with the Freiheit orders and release of detainees in the vulnerable population. The second is the immediate suspension of transfers of detainees in and out of the facility. The third is an increased focus by ICE for granting personal recognizance bonds. And then finally, the fourth is clear adherence to the CDC standards of care for detainees when they are infected with COVID. Those are our asks today, and we thank you all for listening in, and we'd like to open it up for all of us for you to ask questions.
Hi, I had a question, if I can go ahead.
Yes, please.
Hi, this is Colleen Slevin with the Associated Press. I did have some more questions just about the numbers. I know the doctor was just talking about 45 cases in an ICE report, but I see a higher number in Representative Crow's report from the center, and then extra, I don't know if it's extra cases, but another report in that report from Aurora Fire Rescue. And that was, 93 detainees and then 34 from Fire and Rescue. So could someone explain all those numbers and whether they overlap or what they are?
Well, I think, that's part of our cry for help today, because there is a lack of transparency. The numbers that are being reported to the CDPHE are very different than what's being reported to Congressman Crow's office. So last week numbers were, as I indicated, 91 detainees and 13 staff. This week we're seeing a report of 45 in one location and 34 in another. So it is a bit confusing for us, and we are looking for clear numbers and transparency.
And where was the 40, what is the source of the 45 and the 34? What report is that?
There is a accountability report that ICE does to Colorado Congressman Jason Crow, and it's a weekly report, and the 34 was in the report from last week, the same week that the Colorado CDPHE reported 91.
And did I hear the doctor right that the 91 to the state might be including cases from earlier in the year?
You want me to answer? Yes. So yes, based on a communication with CDPHE by email, Ms. Levin, we tried to clarify these, and we obtained information that, they couldn't tell us exactly the precise numbers because it was a ongoing investigation, but that the total, the 91 that they were reporting as of last week was including cases, what they call sporadic cases before this outbreak. But we don't know the exact divide. And that's why, again, the two things I would like to just add is there is an outbreak and it seems to be significant, but we don't have the precise numbers to tell you today.
And doctor, when you said this is the second largest outbreak in the country, what number is that based on? What are you kind of assuming is the number?
Sure. So if you look at the ICE detention website, it's called ICE//detention. You click on there, the ICE Immigration and Customs Informants, they report these numbers. I would say I don't know how frequently they update them, but if you run through, there's three columns. The first column is the number of current cases reported, and the Aurora facility is number 2, along with, or the second largest, along with one facility in San Antonio. And then the first, the one that has 50 two cases at this point is the Lanto facility in Los Angeles County.
Thank you.
You're welcome.
The Adelanto facility was just ordered by a federal judge to release a minimum of 250 detainees because of the outbreak there.
Hey, I have a question. This is Connor from Westward. So I'm wondering,